So I would say a physiotherapy is like a 4-year degree, obviously in South African context, that you actually get to do in most universities in South Africa, that actually focuses onto rehabilitating people. So it's more about actually restoring people's function and movement post, it could be illness, pain or injury they suffered, or disability. So we mostly focuses on to making sure that actually we restore your movement, your normal movement, or the normal way that you used to do things. So it's more of like a rehabilitation process. So when we talk about rehabilitation process, it obviously takes long. There's no quick fix, but I would say, like, in just a few words, it's that, yeah.
Okay. And you mentioned that it's part of the rehabilitation profession, but I'm assuming that within physio there's quite a range of things that you can do and different kinds of physio that a person can be exposed to. So could you please just, delve a little bit into that?
Okay, so I personally love neurological physio. Everyone that I've worked with knows that I actually love that part of physiotherapy, but then there's actually like a broad, when we talk about a broad of things that you can do actually when we talk about physio. So you can do respiratory physio, whereby we focus mostly onto like chest problems, breathing problems. People who have like, chronic obstructive pulmonary diseases, people are like such as asthma, struggling with obviously breathing problems. So when we're looking at like respiratory physiotherapists, like we all know that we are suffering in this COVID-19 pandemic currently, as you know, the world. So a physiotherapist plays a role as well in that, making sure that you actually have proper breathing patterns, and that you actually don't struggle from like a respiratory distress. So we kind of like focus as well onto that when we're looking at respiratory physio. And then moving to the neurological physiotherapist, which is my passion. So we're looking at like stroke clients, we're looking at spinal cord injuries, we're looking at Parkinson's conditions. We're looking at like all these movement, maybe disorders, because obviously once you suffer from a stroke, you do have like a movement disorder, a problem that you suffer from, like hemiparalysis, which actually changes your pattern of walking, the way of doing things as well. So we look into those things. And then we have neuromuscular physiotherapist. It's gonna look like I have so many favorites, but then that is also like my favorite. So we focus mostly onto sport injuries, like if you sustain like a ligament injury, sustained a muscle injury, you sustained obviously a fracture as well. So we mostly focuses onto like sport related injuries. But if you're also suffering from like lower back pain or any pain related to injuries, that's where we classify that as neuromuscular physiotherapy. And then we have cardio physiotherapists that we mostly focus on to heart problems. So that's basically like, the branches, but there's a lot we can go on and on, because we see people of different ages as well. Like when we look at young kids, we see cerebral palsy, which is a neurological physiotherapy. And then we see as well like children suffering from like all the like in all these mentioned injuries as well. So like we see people of all age groups.
And just going back to the chest physio, shout out to all the physios out there who have been great essential workers during this time. Many have recovered because of your efforts, and we really, really appreciate you. So as a physio, where can you be found? Where do physios work?
Okay, you mean as in like the place? Like, okay, we are found in hospitals. There's hospital-based physiotherapists, and then there's house call physiotherapists that you actually you can go and look at your internet. Physiotherapists available in your specific area. There are people like we're having like online like information about where are they based, whereby they can do like house calls or house visits. You just phone them that okay, I might be having COVID. I have a struggle to breathe and whatever. I'd like you to come and see me in my own space, and then we do the home visit physiotherapist, and then you can find them in clinics, especially in like urban areas. Obviously, they are clinic-based physiotherapists. So we mostly everywhere. We pretty much everywhere. You can find them in gym. There are people with their private practices as well that have their own gym spaces. So we everywhere.